Welcome to EMTprep Pulse Check, the podcast where we help you sharpen your knowledge, ace your exams, and stay field ready. Whether you're prepping for the NREMT or looking to stay sharp in the ever-evolving world of EMS, we've got you covered. Each episode brings educational insights, real-world case reviews, and expert tips to boost your confidence, both in the classroom and on the call. Let's jump in.
Hello everybody. In this presentation, we're going to be covering trauma and specifically how it relates to bleeding. We're going to begin by talking about what blood is and why it's important to the body, and then we're going to go into covering how bleeding or the loss of a large amount of blood affects the body and how to treat and manage it. So what is blood? Blood is the fluid within the body that circulates in the veins and the arteries, and it's made up primarily of four different components, the first of which is the red blood cells, also known as erythrocytes. And the red blood cells are the most numerous of the formed elements of the blood, and they're special because they contain these proteins called hemoglobins, which are able to bind to oxygen to allow the transportation of oxygen from the lungs to various cells in the body. But how much oxygen is carried by the red blood cells, which is bound to these hemoglobins, is referred to as the oxygen saturation. The other component in the blood is known as white blood cells or leukocytes. And there's several types of white blood cells, and each one of them has a different specific function, but the overall function of these white blood cells is to fight infection. Antibodies may be produced to fight infection, or the leukocytes themselves will directly attack and kill any type of bacterial invaders in the blood. There's also platelets, and platelets are these small cells in the blood that are essential for clot formation, which is known as coagulation, and they essentially work in trying to minimize the amount of bleeding that occurs from these blood vessels. And then plasma is the watery yellowish colored fluid that makes up more than half of the blood volume total. It consists of about 92% water and 8% dissolved substances such as various chemicals, minerals, and nutrients. The main function of blood is to act essentially as a transport system, and it transports various things such as dissolved gases such as oxygen and carbon dioxide. It transports waste products of metabolism such as water and urea. It transports hormones, various enzymes, and nutrients such as glucose, amino acids, vitamins, and minerals. It also transports those white blood cells, as we mentioned earlier, in order to fight infection, depending on where the infection is throughout the body. So when we're talking about bleeding, it's important to understand what perfusion is. And perfusion, by definition, is the circulation of blood throughout an organ or tissue in an amount that meets the requirement for the tissue's demand for oxygen, nutrients, and waste removal. The cardiovascular system will work in conjunction with the nervous system and the endocrine system to meet the perfusion demands of all different parts of the body, having to adapt to constant changes. So, for example, the cells of the muscle require a certain amount of oxygen depending on whether they're contracting or relaxing. So a muscle that's contracting requires more oxygen and nutrients than one that's relaxing. So for example, and also, so when you're working out, that's why your heart rate will increase, because your body will try to begin to meet the demand for the oxygen that's required for your body in order to work out like that. So on the other hand, hypoperfusion occurs when the tissues or organs' demand for oxygen is not met, and when this occurs, it results in what's known as shock. And we'll talk a little bit more about shock, but when shock isn't treated properly or not in time, it eventually results in cell death because the cells just aren't getting the oxygen and nutrients that they need to survive, which then results in organ system dysfunction and eventually death of the person. Hemorrhage is defined as any profuse amount of bleeding from the blood vessels. Hemorrhage can be something as small as a paper cut on the finger to something as large as a laceration of an artery or an internal organ. There's two types of hemorrhaging. You can have internal hemorrhage, which is bleeding that occurs within the body and is typically not seen. And then there's external bleeding, where usually the skin is broken and blood is leaving the body. The blood loss can occur in just about any part of the body depending on the type of injury that occurs to the person, and the most obvious cause of bleeding is due to trauma. Internal bleeding, as I mentioned, is bleeding that is not visible and does not break the skin. So it essentially shows no outward sign of bleeding. And for this reason, it can be very difficult to detect whether or not a person is even having internal bleeding, let alone where the person might be bleeding from. And depending on what is the cause of the bleeding and where the bleeding is occurring in the body, internal bleeding can be very life-threatening because it's not possible to stop internal bleeding without surgery. Injuries to internal organs or broken bones can result in serious amounts of blood loss within the body cavities. The femur alone, for example, can result in 1 or more quarts of blood loss. With internal hemorrhage, you can have 2 different types of bleeding. You can have traumatic internal bleeding and non-traumatic internal bleeding. Some examples of traumatic internal bleeding are things like I mentioned, long bone fractures, such as the femur, which hold a lot of blood. You can have a lacerated liver or ruptured spleen, which will continue bleeding into the abdominal cavity. You can have a hemothorax, which is typically caused by damage to the lung, which results in bleeding that fills up the pleural cavity. And similarly, you can have cardiac tamponade, which is bleeding that occurs within the heart and fills up the pericardial sac with blood. Some examples of non-traumatic internal bleeding are things like stomach ulcers, which essentially are sores within the stomach due to the acid eating away at the stomach lining. You can have ruptured aneurysms, which are weak spots within the blood vessels that rupture and leak blood, and esophageal varices, which are swollen veins in the esophagus that have the potential to rupture as well and cause internal bleeding. On the other hand, there's external hemorrhage. An external hemorrhage is bleeding that is visible through breaks in the skin. The severity of bleeding is determined by the extent of the wound, so how badly the person's injured, and the type of blood vessel the bleeding is coming from. So it could come from the capillaries, the veins, or arteries, and all of which have different amounts of bleeding occurring from them. Arterial bleeding is the most serious type of bleeding because of the large volume of blood that can be lost in such a short amount of time. Blood is pumped through the arteries at a very high pressure, so bleeding from an artery is usually characterized by bright red spurting blood. The blood will literally be shooting from the body, and this type of spurting will typically occur until the blood pressure drops so much from the amount of blood loss, and eventually the spurting will stop. And this type of bleeding is very difficult to control due to the large size of the arterial blood vessel and the pressure that is pushed through these types of vessels. On the other hand, venous blood is more of a dark red blood because it has a lack of oxygen as opposed to the blood in the arteries. This type of bleeding is described as more of a flow which is steady or gushing. Due to the fact that there's less pressure, it doesn't spurt like an artery. And because there's less pressure within the veins, it also makes it easier to control than arterial bleeding. If a vein, however, is cut transversely or all the way through, it has the potential to recoil into the tissues, which will stop the bleeding on its own. But if it's cut vertically or along the vein, it will continue to bleed until pressure is applied. With deep venous bleeding, it can be very profuse, and unlike arterial bleeding, it can be very life-threatening. And then there's capillary bleeding. Capillary bleeding is the most common form of bleeding, and it's described as blood that just oozes from the capillaries due to the fact that there's really not a whole lot of pressure pushing the blood out. It's usually not serious and can be controlled very easily, and in many cases it will clot and stop by itself. The severity of bleeding plays a large role in how the body is affected by bleeding. The average human body contains about 5 liters of blood total volume. The body can't tolerate losing more than 20% or about 1 liter of that blood in a short amount of time. There's different factors that play a role in the severity of bleeding. one of which is the rate of blood loss, which affects how people are able to compensate for that blood loss. So for example, someone who donates blood over about 15 to 20 minutes will be able to compensate better than someone who loses that same amount of blood in just a few seconds due to a trauma that causes an arterial bleed. Age and size of the person also affects the severity of blood loss. For infants and children, they have less total blood volume, so they may show greater effects with bleeding with smaller amounts of blood loss than a larger adult would. Blood clotting is the natural physiological response of the body to bleeding, and it's just also known as coagulation. And coagulation is the process that prevents excessive bleeding when a blood vessel has been damaged. As I mentioned, there's cells all throughout the blood called platelets, which will aggregate or come together at an injury site and attempt to plug the hole and prevent further bleeding from occurring. And when there is damage to a vessel, these cells called clotting factors will activate a reaction that triggers the formation of what is known as fibrin strands. And these fibrin strands make the clot stronger and hold it in place long enough for the vessel to be able to repair itself before the clot is broken up and prevents the bleeding overall. There are several factors that affect the body's ability to coagulate or form blood clots. One of which is when a patient has an injured site and they continue to move that site, it can cause the blood clots to break off before they're able to fully restore the vessel, which causes bleeding to continually occur. Also, severe damage to vessels that are too big to clot, such as a complete laceration of a vessel, doesn't give enough time for a blood clot to form, and so they're unable to coagulate properly. There's also some medications that interfere with the coagulation process, such as aspirin, which hinders the ability of platelets to aggregate and form that initial blood clot. And also beta blockers prevent vasoconstriction, which is an important role in forming blood clots. Also, there's a condition known as hemophilia, which is a condition in which a person just isn't able to form a blood clot because they lack part of one of the proteins that is needed in that initial reaction to form the blood clot. As I mentioned earlier, shock is a condition of the reduction of tissue perfusion that results in an inadequate delivery of oxygen to the cells of the body. And there's different conditions that cause shock and different ways that a person can develop shock, but specifically on the topic of bleeding, we're going to talk about hemorrhagic shock. Hemorrhagic shock is a type of shock that's due to a lack of blood volume because of excessive blood loss. When this occurs, it results in what's known as hypovolemia. Hypo meaning low, and volemia meaning volume of blood. So there's a low volume of blood within the body, and due to that, there's not enough perfusion to the tissues. And hypovolemia, specifically hemorrhagic shock, is the greatest life threat to trauma patients. Hypovolemic shock caused by blood loss has been classified into 4 classes by the American College of Surgeons Committee on Trauma. Class 1 is classified as any amount of blood loss that is less than 750 milliliters. Class 2 is 750 to 1,500 milliliters. Class 3 is 1,500 to 2,000 milliliters of blood loss. And Class 4, which is the most severe, is any greater amount than 2,000 milliliters of blood loss. Hemorrhagic shock occurs in 3 successive stages. There's compensated shock, decompensated shock, and irreversible shock. And as an EMS provider, your job is to be able to recognize when a person is in shock and be able to treat them immediately. With compensated shock, the body is still able to compensate for the amount of blood loss that has occurred. They do this by maintaining the blood pressure in order to continue perfusing to the brain and continue getting oxygen to the brain. And in order to do this, the body will constrict its blood vessels and increase the heart rate. And by doing this, the increase in the heart rate and the vasoconstriction causes a higher blood pressure, which allows blood to still be perfused to the brain. Some of the signs and symptoms of a person in compensated shock is that they'll be cool and clammy. and they'll also show signs of anxiety. And so it's important to really understand these signs and symptoms and be able to identify when a person is in compensated shock, because just because someone has a normal blood pressure doesn't mean that they're not in shock. So you need to be able to recognize that, okay, this person might be in shock, so you would know to treat them appropriately. The next level of shock is decompensated shock. And this is considered a late stage of shock when the blood pressure falls because the person is no longer able to maintain those compensatory mechanisms, and they lose the vasoconstriction, and their heart rate slows down, causing that fall in blood pressure. And when they lose their blood pressure, the perfusion to the organs and tissues decreases, which is a very emergent sign that this person really needs help quickly. Some of the signs and symptoms of someone in decompensated shock is that they will be hypotensive, they will have altered mental status due to the fact that they're no longer able to adequately perfuse blood to the brain, so the brain isn't getting oxygen, and they also have cyanosis because the tissues as well aren't getting an adequate amount of perfusion. If someone doesn't receive treatment in the compensated or decompensated stages of shock, they'll eventually fall into what's known as irreversible shock. And irreversible shock occurs due to the body not being able to respond to treatment, and at this point recovery is impossible due to the extensive amount of cell death because the cells have not been getting any perfusion for quite some time. This happens to be the last stage of shock just before the person dies. And some of the signs and symptoms that you will see in someone who is in irreversible shock, they'll have multiple organ failure, they'll eventually go into respiratory arrest, which will eventually lead to cardiac arrest. When you begin to perform your assessment of a patient, one thing that you definitely want to keep in mind is the mechanism of injury. A person who has sustained a high energy mechanism of injury, it should increase your suspicion that the person may have sustained serious injuries such as severe bleeding. This can be things such as blast injuries, which are injuries from explosions, falls, especially falls from large heights, and motor vehicle accidents, especially at high speeds. When you respond to these high energy accidents, you want to be suspicious to the fact that a patient may have suffered an injury that may have caused serious bleeding, whether internally or externally. Some of the significant mechanisms of injury that should raise your index of suspicion to the fact that someone may have sustained some form of severe bleeding are things such as motorcycle crashes, vehicle versus pedestrian accidents, falls from heights greater than 20 feet, if a person's ever ejected from a vehicle or vehicle rollover. You have high-speed vehicle crashes, penetrations to the head, neck, chest, or abdomen. If you have an unresponsive patient or a patient with altered mental status following a traumatic event, or death of an occupant in the same vehicle, or multi-system trauma. These are all types of accidents that make you want to think that this person could have sustained an injury that could cause a life-threatening amount of bleeding. During the primary assessment of your patient, it's important to determine the patient's level of consciousness. You can do this by using the easy AVPU scale, where A means that the person is alert to person, place, time, and event, and they acknowledge you when you're talking to them. V means that the patient only responds to verbal stimuli. P means that they only respond to painful stimuli, and U means that they're unresponsive. If someone has an altered level of consciousness following some form of a traumatic event, it should raise your awareness to the fact that they could be bleeding, whether internally or externally, so much that their blood pressure is decreased and they're not able to perfuse enough oxygen to their brain. This is someone that you want to get to the hospital immediately. After you've determined the patient's level of consciousness, the next step is to move on to assessing the patient's airway. And you want to do this to make sure that there's no structural damage. Whenever you have a trauma, you always want to be sure to use the jaw thrust maneuver as opposed to the head tilt chin lift, because you want to maintain that neutral inline stabilization of the spine in case they have any injury to the spine or the spinal cord. If there is any bleeding from the mouth or the facial area, you want to be sure to use suction, remove that blood to prevent it from occluding the airway. You'll then move on to assessing the patient's ventilatory status. You'll do this by auscultating breath sounds. You want to listen to the breath sounds on both sides for any abnormal breath sounds as well as any lack of breath sounds. You want to palpate the chest and check the chest wall for integrity. Make sure there's no broken ribs. You want to administer oxygen via another breather and treat any life threats to breathing before moving on in the assessment. Then you'll move on to assessing the patient's circulatory status. In order to do this, you want to check the patient's pulse, checking for the rate, the rhythm, and the quality of their pulse. Assess the patient's skin. That might show any signs that there's a lack of perfusion. And look for signs of hemorrhagic shock. If there's any amount of profuse external hemorrhaging, you want to manage this by applying pressure. And if it's on extremity, you'd want to put a tourniquet if the bleeding doesn't stop after applying pressure. You'd also want to treat this patient for shock by giving them oxygen and keeping them warm with a blanket. You also want to attempt to obtain the patient's history. So you want to investigate the chief complaint and obtain their history using the OPQRST and sample mnemonics. You also want to ask if they take any medications such as blood thinners, beta blockers, calcium channel blockers, nitroglycerin, or antidysrhythmics, as these medications have the ability to hinder the body's ability to compensate for shock. In this case, minor injuries such as fractures could be a lot worse than they actually seem, especially in older patients. Whenever you have a trauma patient, some of the signs and symptoms that you want to be aware of on scene are things like profuse bleeding that doesn't stop on its own, if the patient seems very anxious, if they have tachycardia, tachypnea, hypoxia, or signs of shock. All of these things will lead you to believe that the patient's condition is deteriorating. After you perform the primary assessment and you've dealt with any life-threatening conditions to the airway, breathing, or circulation, you then want to move on to doing a physical exam. In this, you'll perform a systemic, hands-on, full-body physical assessment. Whenever you have a trauma patient, you want to be sure that you palpate the entire body and note any pain or tenderness, because this could be an indication that the person has some form of internal bleeding. You also want to expose the patient's body by removing their clothes or cutting their clothes to look for any hidden contusions or bruises or any penetrating wounds or lacerations that you could initially see when they had all their clothes on. There are a few special considerations to keep in mind in terms of age when you're dealing with a patient who is bleeding. For example, children do not have, they don't conserve fluid as well as adults do, so they have a much lower tolerance for volume loss, meaning that their body gets affected a lot worse whenever they lose a large volume of blood. On the other hand, children also have a longer compensatory function, meaning that they stay in that level of compensated shock for a lot longer than an adult would. So sometimes it's hard to tell if the patient's really in shock because they're able to manage their blood pressure for so long, but they will have an abrupt decrease in the function if the problem isn't managed soon enough. So it's important to keep in mind that when a child does have a large volume of blood loss, just because they may not seem like they are in shock doesn't mean that they're not. And so you want to treat the patient for shock, otherwise their condition may deteriorate very quickly. It's also important to know that children have a large surface area to weight ratio. This means that they get a lot colder a lot easier, and when this happens, it leads to problems with coagulation, and it can also lead to hypothermia in shock. Another special population consideration is the geriatric population. Geriatric patients, as I mentioned already, take a lot of different medications, most of them do, that affect their body's ability to compensate. And these are things like the beta blockers, calcium channel blockers, nitroglycerin, and antiarrhythmics. Geriatric patients, like children, also don't conserve fluid very well and have a very low tolerance for large volumes of blood loss. And in addition, geriatrics also tend to have other conditions that are worsened by shock. So that's why it's very important to know a patient's history so that you know the various types of conditions that they have that might get worse if they go into shock from volume loss. The first step in management of a bleeding patient is to make sure that you're wearing the appropriate body substance isolation. There are various communicable diseases that can be obtained through blood, so it's very important that you protect yourself by wearing gloves, goggles to protect your eyes, and a face mask. And if the person happens to have spurting blood from an artery, you want to be sure to wear a gown, as you don't know where that blood might end up. Once you are wearing the appropriate PPE to manage a patient, the first thing you want to do is ensure that the patient's airway is patent and hold spinal immobilization. If you need to, if the patient's unconscious, you want to insert an oral adjunct to prevent the tongue from occluding the patient's airway. You also want to administer 100% oxygen and assist with the patient's breathing if they're unable to ventilate themselves using a bag valve mask. To manage the bleeding itself, if you have external bleeding from an extremity, the first thing that you want to do is apply direct pressure. You want to apply pressure over the wound with a dry, sterile dressing and hold the pressure dressing in place by wrapping it with gauze. If there are no fractures in the extremity, you want to be sure to keep the extremity elevated in an attempt to decrease the amount of blood flow to the wound so that the body can coagulate and stop the bleeding. Some things to keep in mind when doing direct pressure. You may need to use multiple dressings if the wound is a major wound. And when you do this, you want to apply additional dressings, being sure not to remove the original one because the original one is maybe holding a clot that is there, and if you remove it, it might remove the clot and continue bleeding. Also, with direct pressure, that's usually most effective for capillary and venous bleeds. That may not work well enough for an arterial bleed because of the high amount of pressure. If direct pressure with a pressure dressing does not control the bleeding, the next step would be to use a tourniquet. And remember that you'd only use a tourniquet for bleeding that's on an extremity. In order to do this, you would apply the tourniquet proximal to the injury, meaning closer to the body than the injury is, and you would tighten it until the bleeding stops. It's very important that you mark the time that the tourniquet was applied by writing it on a piece of tape and taping that to the tourniquet so that the receiving facility knows how long the tourniquet's been applied for. It's also important to not use any really thin material as a tourniquet, such as string or wire, because as you tighten it, the thin material will actually cause more damage and more bleeding. Another form of bleeding management is the use of splints. There's various forms of splinting that can be used for various injuries depending on the type of injury as well as what your agency carries. Splinting techniques are typically used to treat musculoskeletal system abnormalities. The main indications for splinting are to temporarily immobilize a limb for pain and spasms, to decrease swelling, and to minimize movement of broken bones, which prevents them from tearing tissues and vessels and allows for blood to clot. Air splints are another type of splint that act as a pressure dressing to the entire extremity. They're used for venous bleeds only because they don't have enough pressure to stop arterial bleeds. They're usually pumped up to about 50 millimeters of mercury, and they control hemorrhaging as well as stabilizing any type of fracture. Traction splint is a type of splint that's designed to stabilize specifically femur fractures. And how it works is that traction is applied to the ankle while countertraction is applied to the groin. And when the traction is applied, it reduces thigh muscle spasms and prevents one end of the fracture from overriding the other. The goal of this type of splint is to reduce the pain and decrease the amount of bleeding which occurs to the soft tissues of the leg. Whenever a patient has bleeding from the ears or the nose following a head injury, it may indicate that the patient is suffering from a skull fracture, specifically a basilar skull fracture in which the tympanic membrane in the ear has ruptured. It's important to note that If you do have a patient with this type of bleeding, you do not want to plug the ears or the nose in an attempt to stop the bleeding, as it may cause blood to collect in the head and increase intracranial pressure, which may cause further damage. If a patient has a nosebleed, also known as epistaxis, that is not related to a head injury, in order to stop that, you would compress the bridge of the nose and have the patient lean forward. Often people want to lean backwards, but that's not good because that has the potential to introduce blood into the airway and cause aspiration. If you do have a patient with a medically induced nosebleed, you want to be sure to check the patient's blood pressure to evaluate for the potential that they might be having a hypertensive emergency, which can cause a nosebleed. For internal bleeding, there's not much that can be done, or nothing really that can be done to stop the bleeding in the field. However, it is important to be able to recognize that someone does have internal bleeding. Some of the signs of internal bleeding are things like bright red blood that comes from the mouth or the rectum. If the patient has pain, tenderness, bruising, or swelling anywhere in their body that you discover during your physical exam. If the patient presents with guarding, which is the tensing of the abdominal wall due to injury or inflammation of internal organs, which can be due to some form of laceration or something that could cause internal bleeding, or hematemesis, which is the vomiting of stomach contents with blood as well. Management for someone who you suspect has internal bleeding consists of maintaining the patient's airway and breathing, treating the patient for shock by giving them 100% oxygen and keeping the patient warm. And you also want to minimize any movement of the body or of the injured part of the body to try and allow for coagulation to take place and stop the bleeding on its own. Ultimately, your priority is to transport the patient to the appropriate facility with surgical capabilities, because the only thing that can really stop internal bleeding is surgery. Another important aspect for the management of bleeding is trying to stabilize the patient's body temperature. Hypotension, specifically from hypovolemia, interrupts thermoregulation, which is the body's ability to maintain their temperature. This creates a high risk for hypothermia, especially with geriatric patients and children. And hypothermia in trauma patients can lead to problems with coagulation as well as acidosis. And lastly, a transport decision needs to be made at some point during the assessment of the patient. And this is based off the patient's severity of bleeding and injury. We need to determine if the patient needs to go to a trauma center in order to receive surgical capabilities, or if the patient needs ALS mutual aid, for example, if the patient requires fluid resuscitation en route to the hospital, or if they need aeromedical transport in order to get to the hospital in time to increase their chances of survival.
First question. When assessing a patient with a gunshot wound, you should: Option A, look for the presence of an exit wound. Option B, always immobilize the spine. Option C, cover the wound with an occlusive dressing and secure it on 3 sides. Or option D, apply ice to the wound. The correct answer is look for the presence of an exit wound. The presence of an exit wound can alert you of the bullet's path through the body. You always want to consider spinal immobilization, but a gunshot to the hand, for example, does not necessarily require spinal immobilization. Next question. You respond to a call for a gunshot wound. Your patient is a 26-year-old male who has been shot in his right leg above the knee. He presents with a heart rate of 140, is alert and oriented, and has a pulse, motor, and sensation distal to the gunshot wound. There's approximately 1 liter of blood loss from the wound in what appears to be an arterial hemorrhage. What is the best way to manage this hemorrhage? Options. Option A, attempt to remove the bullet. Option B, apply direct pressure until tourniquet is secured. Option C, cover and elevate the injured leg above. Or option D, immediately apply a tourniquet. The correct answer is apply direct pressure until tourniquet is secured. In this situation, applying direct pressure should only take place while preparing and applying the tourniquet. The tourniquet is the definitive way to stop the hemorrhage. Next question. You are responding with police to a report of gang violence. Police have secured the scene and requested medical resources. Your patient is a 17-year-old male who has a gunshot wound to his chest. The patient is pale, diaphoretic, hypotensive, and is confused. He is complaining of severe difficulty breathing. You suspect a tension pneumothorax. What type of shock is your patient most likely in? Option A, cardiogenic shock. Option B, obstructive shock. Option C, hypovolemic shock. Or option D, distributive shock. The correct answer is obstructive shock. Obstructive shock is the result of physical obstruction of the heart pumping or blood returning to the heart. Tension pneumothorax, cardiac tamponade, and pulmonary embolisms can cause obstructive shock. Next question. Your patient cut his leg with a circular saw. After 20 minutes, bleeding is controlled, but you believe the patient lost at least 1 liter of blood. The best position for this patient is option A, supine, option B, Trendelenburg position, option C, on a backboard in full spinal immobilization, or option D, Fowler's position. The correct answer is supine. The patient should be laid supine. Trendelenburg position is no longer indicated. Next question. You arrive at a local swimming pool to find a 23-year-old male lying on the deck with bright red blood spurting from his groin, and he's screaming in pain. Your first priority is to option A, control the bleeding, option B, elevate his legs, option C, ensure an open airway, or option D, apply 100% oxygen. The correct answer is control the bleeding. Bright red blood spurting from a wound should alert you that an artery has been severed and the condition is life-threatening if not controlled quickly. The patient is screaming in pain, which is a good indicator of an open airway. Your first priority is to apply direct pressure to the wound in hopes of controlling the bleeding. Next question. Your patient is a 16-year-old male who has been impaled through the leg by a piece of wrought iron about 1 foot in length. He is bleeding around the impaled metal and appears to be in excruciating pain. When treating this patient, it is important to option A, secure the impaled metal in place and leave it in the leg. Apply a dressing around the impaled metal. Option B, leave the impaled metal in the leg. Do not apply a dressing because this could move the object, causing additional tissue damage. Option C, apply a tourniquet above the injury to limit bleeding, then slowly remove the metal and provide rapid transport. Or option D, apply a tourniquet above the injury to limit bleeding, then provide rapid transport. The correct answer is secure the impaled metal in place and leave it in the leg. Apply a dressing around the impaled metal. Impaled objects should be secured and left in place to reduce the risk of causing more bleeding, damaging nerves, blood vessels, or tissues. Next question. You are on scene at a remote logging site with a logger who was impaled by a falling branch. The branch went directly through the patient's upper right thigh. Members of the logging crew removed the branch prior to EMS arrival. You estimate that your patient has lost nearly 2 liters of blood and is in shock. What class of hemorrhage does this amount of blood loss represent? Option A, Class 1. Option B, Class 2. Option C, Class 3. Or Option D, Class 4. The correct answer is Class 3. A blood loss of 1,500 to 2,000 milliliters, approximately 30 to 40% of your total blood volume, is categorized as Class 3 hemorrhage. Next question. Your patient is a 55-year-old male who has been impaled through the cheek by a large fishing lure. He is unconscious and has a small amount of bleeding coming from his cheek. The fishing lure is inside his mouth. When caring for this patient, you should: Option A, remove the fishing lure. Option B, trim the lure so that it does not obstruct the airway, then leave it in the cheek. Option C, hold the fishing lure in the patient's mouth to prevent choking but leave it impaled. Or option D, stabilize the fishing lure and bandage around it. The correct answer is remove the fishing lure. An impaled object should be removed in only 2 cases. The first is when it is impaled through the chest and prevents CPR. The second is when it could cause an airway obstruction. In this case, the fishing lure has the potential to cause an airway obstruction in your unconscious patient and should be removed. Placing gauze on the inside of the cheek also poses a possible airway obstruction, and trimming the lure will likely cause further damage to the tissues. Next question. You and your partner are responding to a car shop where a mechanic has a screwdriver impaled through his chest. You arrive and find your 36-year-old male patient sitting inside the garage, sitting on a chair in mild distress. The patient is ANO times 4 and states that he accidentally fell onto a screwdriver. The patient's vitals: respiratory rate of 24 and unlabored, heart rate of 90, and a blood pressure of 110/70. Which of the following should be an imperative part of your assessment in this situation? Option A, assess CMS. Option B, checking a CBG and performing a stroke assessment. Option C, listen to breath sounds, repeat often. Or option D, calculate a GCS score. The correct answer is listen to breath sounds and repeat often. Since this patient has an object impaled in his thorax, it is imperative to listen to breath sounds initially as soon as possible and continue checking throughout your transport of this patient. The fact that the patient is not experiencing dyspnea shouldn't lead you to think that there is no pleural injury. All of these answers are important. It's a matter of picking the most right answer. Next question. Your coworker is attempting to control bleeding by applying direct pressure to a patient's partially amputated right leg. The patient was ejected from the bed of a pickup truck when the truck was involved in a T-bone style crash with a garbage truck. The patient is confused, has rapid but shallow respirations, and has a weak carotid pulse. Blood is still freely flowing from their right leg despite the direct pressure. What stage of hemorrhage do you suspect your patient is in, and how should you attempt to control the bleeding? Option A, stage 4 hemorrhage. Apply a tourniquet above the partial amputation. Option B, stage 3 hemorrhage. Apply a tourniquet above the partial amputation. Option C, stage 4 hemorrhage. Elevate the right leg, place the patient in Trendelenburg position, and cover them with a blanket to counteract shock. Or option D, stage 3 hemorrhage. Elevate the right leg, place the patient in Trendelenburg position, and cover them with a blanket to counteract shock. The correct answer is stage 4 hemorrhage. Apply a tourniquet above the partial amputation. Trauma guidelines indicate that a tourniquet should be applied to a bleeding extremity if direct pressure does not stop the bleeding. After applying a tourniquet, you should cover the patient and keep them warm. Stage 4 hemorrhage is characterized by weak or absent core pulses with inadequate respiratory effort and altered mental status or decreased level of confusion.
Thanks for tuning in to EMTprep Pulse Check. If you found today's episode helpful, be sure to subscribe, leave a review, and share it with your classmates and crew. For more test prep tools, study guides, and practice exams, head over to emtprep.com. Until next time, stay sharp, stay safe, and stay on pulse.